Let me welcome each of you here tonight, our guests, our media representatives, and our RCC trustees and RCC staff. We thank you for coming. We've got a few Baptist seats down front if you want to come on a little closer, if that's all right. The Randolph Community College Board of Trustees Distinguished Service Award was established in 2002. The nomination for this year's award was received in April and reviewed by the Resource Development Committee of the Board of Trustees, chaired by Kurt Lorimer. The Resource Development Committee's recommendation was presented to the Board of Trustees in May, and the nomination criteria states that an award recipient must be an individual, a group, or an organization that has made a long-term consistent commitment that is extraordinary and had visible impact or results directly related to the support of the mission of Randolph Community College. It is an honor to announce the Randolph Community College Board of Trustees unanimously agreed to select Randolph Health as the recipient of the 2018 Board of Trustees Distinguished Service Award. Randolph Health staff have served Randolph Community College in a variety of ways, including those through the RCC Foundation, the health program, the advisory committee, participation in Randolph Foundation events like Dancing with the Stars, and participation in the annual President's Community Advisory Council. Randolph Health staff were an integral part of the healthcare pathway in partnership with the Asheboro City Schools and Randolph County Schools as part of the Pathways to Prosperity program. In 2007, when RCC nursing program was experiencing the greatest transition and challenges in that program's history, Randolph Health provided major support to the college to help ease that transition. Randolph Health has provided precious clinical sites for RCC students for many years. When the college once had to reoffer a class, Randolph Health graciously sent the college an instructor who was a professional role at the hospital and made up the difference between the college, what the college would pay for that person and what the person would have earned at the hospital. When RCC began its university center, Randolph Health willingly and graciously transitioned its relationship with Winston-Salem State University to the college so it could be a part of the university system. They have been by our side working with us to expand opportunities for certified nursing assistants, and they have supported us during the times that we've struggled to fill nursing instructor roles. They hire many of our graduates and have been heavily involved in the planning of the new Allied Health Center, so the future students receive the training and preparation needed in today's healthcare environment. Randolph Health has been a true community partner for us, giving us long-term, ongoing support over the years. We are honored to present them with this award for these and many other reasons. At this time, I'd like to call on Dr. Shackford to share a few comments regarding Randolph Health.
Thank you, Mr. Chairman. I'm very excited about this award, and I'm so glad that the recipient of this year's Distinguished Service Award is Randolph Health. I want to just add, our chairman just gave a rundown of many of the great ties of relationship that we've had through the years. I want to go back and just expand just a little bit on when I first came to RCC as president, the nursing program was in a decline. The NCLEX scores were going down, and each year the weakest employees that the hospital was hiring each year was RCC graduates. And it was embarrassing because we felt it was our responsibility to be providing the best people you could hire and to meet the nursing need. And I knew when I'd only been president 5 weeks when the headline story in the paper was RCC's nursing program put on probation. That was the front page of the newspaper, and I thought, well, it's time for me to go meet the folks up at the hospital. And I did, and went up and had a meeting with, at that time, Bob Morrison, who's back here, and Tremonio Crawford. And I know y'all remember that meeting well. We sat down and talked, and I asked what your experience was with our college and our nursing program and our graduates. And we had a very frank conversation. And I said there's some things I wanted to do differently, and I laid out several things that we wanted to do differently. And I remember Bob and Tremonio both saying, well, these are things that we've been asking for and hoping for, and there's been one reason or another that it couldn't be done. You do these things and you'll find us to be your greatest allies. And we started making some changes. And by 1 year, well, our NCLEX scores, they were at 71%. The state wants them at least 85 or 90. If it gets down under 80, they want some explanation. Get under 75, you're called to Raleigh. I was called to Raleigh. And I said, it will not be this next year. And we've made a lot of changes. A lot of changes in the program, a lot of changes in the personnel, a lot of changes overall in the nursing program. Our NCLEX scores went from 71% to 88 to 95 to 100. And it was a remarkable transition. But what I'm saying is, we could not have made it. The hospital had every reason to bail on us and say, look, we don't trust your graduates. You're not meeting our needs. They're not learning what they need to learn. The headline in the paper is an embarrassment. We'll go get our graduates from GTCC and Davidson and everywhere else. They said, you do what you can do for this program and we will stand by you. And they have stood by us from that day forward through all these years. They did not bail on us. They did not cast us out. They have stood by us in all the ways that Mac just went through. They've provided instructors, they've provided clinical sites. It's just incredible, the relationship we've been able to have with them. They've helped with our nursing programs, our CNA programs, so many different ways that they've been a wonderful partner to us. And when you think about the criteria that our chairman read about someone who over a long period of time has made a real impact on the college, it has been over a long period of time that Randolph Health has been one of the best supporters in our community. And they work with us, they hire our graduates. Our graduates now are not the weakest people they hire. In fact, many of our graduates now earn the first year high performer. And we're very proud of that, to have turned it around. We turned it around because you did not give up on us, and we pledged to work with you. And we're very proud of our relationship. And I just wanted to personally congratulate you. Having been on many of those negotiations with you, I just wanted to personally congratulate you on earning this award. And to Bob and to Steve and to Angie, through these years and in the years to come, you're a great partner to RCC. And thank you for all you've done.
Thank you, Dr. Shackford. Kurt Lormer, if you'll come forward, and Dr. Shackford, if you'll come back up, please. On behalf of the Randolph Community College Board of Trustees, it is my great privilege to ask the representatives from Randolph Health to come forward to receive the 2018 Community College Board of Trustees Distinguished Service Award. If you would come forward, please. Thank you so much. On behalf of the trustees, Let me present this to you, the Distinguished Service Award presented to Randolph Health. Thank you very much. We've got plenty of time for speeches, so if you want to file back and make speeches, you're welcome.
Good afternoon. I'm Angie Orth. I'm the CEO of Randolph Health, and I want to just sincerely thank you for the opportunity to be here today and to share this wonderful acknowledgement with the team here at Randolph Health. Since I've been here in Asheboro and in the county last 5.5 years, it has been an absolute privilege to work with the college. Bob and his team have been absolutely outstanding, and I look at it as a real partnership, and there's reciprocity. So even though we are receiving this award, the work that the community college does in our community is absolutely outstanding. In fact, this year we hired many nurses. We hired a total of 15, which came from multiple colleges, but many of which came from the community college here. And we could not serve our patients the way we do without the partnership that we have with the college. It is becoming more and more challenging in our industry to retain high-quality employees, and it's our commitment to be your preferred provider of care in our county at large. And so we have to keep those jobs filled, and it is just an absolute pleasure to continue to be your partner. So thank you. Appreciate it.
Good evening. I'm Tremontia Crawford. I'm the Chief Nurse Officer and Vice President at Randolph Health. You can see how excited I was for this award. Me and many members of my team, our team, we got here about 30 minutes earlier because we were so excited about this award. So, you know, you can't do anything by yourself. It takes a village, it takes many people to make things happen. And it's really those people that are working at the bedside, that are working with our patients, that are most important to our health care. Asheboro and Randolph County deserves a great healthcare entity, and we represent that. We hope you're proud of the excellent care that we give every day. And I just want to compliment the team that I have here with me. If you'll join me in telling them thank you. They are the ones that make it happen. So we thank Randolph Community College for this award, and a partner you have had, and you will always have at Randolph Health.
Thank you very much, all of you. If anybody else would like to speak, you're welcome. No? Okay.
All right.
Thank you so
so
much.